Coming up today, former President Biden's diagnosis puts a spotlight on prostate cancer. We explain when older men do and don't need to be screened, plus treatment strategies for advanced disease. And fighting the summer slump. See what expert trainers do to keep young athletes in off-season shape. Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. Two topics to discuss today. Youth athletes, well, they don't sit around all summer. The health system's strength and athletic development supervisor, Roger Allen, he is getting ready to run through some drills this morning and show us how he keeps his athletes in shape. But before we get with him at the Sports Medicine and Performance Center, I'm here at the desk with urologic oncologist Dr. Will Parker and Chief Medical Officer Dr. Steve Stites. Good morning to both of you.
Good morning.
Good to have you guys on this Friday.
Well,
of course,
I was going to go do that summer athlete program too.
I know. I bet you were. I bet you were. You were all over that. Well, of course, we have to establish neither of you are involved in Biden's health care, but you don't have direct knowledge. You have a little bit of knowledge, but the fact that you guys are doctors, you have a little bit of insight into what we're all hearing in the news right now. Dr. Stites, you're a chief medical officer, but you have been diagnosed with prostate cancer in the past, so that gives you a little bit of insight. You have some medical knowledge, but you also have knowledge as a patient. So as a patient, what is it like to receive that type of news?
You know, Jill, it's probably not the best day of your life. Nobody ever wants to hear the word cancer, and it's a little spooky. I had a grandfather who passed away with cancer, and my brother had prostate cancer as well. And so it's a little bit, it hits your heart a little, and you kind of think, what's going to happen to me? Fortunately, mine has been, and by the way, in full disclosure, this is my doctor, so if things don't go well, I just blame him.
I know, right? Right. Fair enough.
So,
no pressure.
I saw his predecessor before, Bradley Thrasher, and then Dr. Parker, and I've had outstanding care, right down to the prostate biopsies, which I get with some frequency. I'm a pro. A friend of mine just had to have some prostate biopsies. I coached him all the way through it, told him all the stuff he had to do.
When were you diagnosed?
I think I was diagnosed around 2015 or 2016, something like that. It's been a while.
How were you treated?
So I haven't been treated. I have a lower grade malignancy. And there's a group of patients who have prostate cancer who are kind of in this sort of no man's land where you don't really get treatment, you don't get it taken out, you just watch it periodically, and you get follow-up scans and biopsies. And last time I saw the good Dr. Parker here, he said, we're going to go a little longer between your next prostate biopsies because most of my biopsies don't have cancer in them right now. So as long as it doesn't have cancer and my scans look good, I'm okay.
Okay, we like to hear that.
But you don't get to say you don't have it, unfortunately.
Unfortunately not.
Right.
I tried that for Roach. He told me no.
Okay, well, and I didn't know that you just, I guess you just keep watching it, but there's no real direct treatment. So, Dr. Parker, then how common is stage 4 prostate cancer?
Yeah, so I think, obviously the former president's diagnosis brings this into stark relief. Prostate cancer is a spectrum of diseases. So we have on one end low-grade cancers like Dr. Stites, where it doesn't necessarily require treatment. And then as the disease progresses, you can get into these more advanced stages. Stage 4 prostate cancer represents about 5% of men who are diagnosed with prostate cancer. So it's much less common than these lower grade, lower stages.
So we're hearing all sorts of numbers flying around. So let's talk about the Gleason score, what it is and what does it tell us?
So it's important to separate the Gleason score from staging. So staging really refers to how far has the cancer spread. The Gleason score refers to how aggressive the cancer is going to behave. It is a scale that runs from 6 to 10, which is a little odd, but 6 being the lowest grade, it's the least aggressive, and 10 being the highest grade. The former president's diagnosis, as they had relayed, was, I believe, a grade 5 is what they had announced, and so that's on the higher end. That relates to a Gleason 9 or a 10.
So Biden's office, they said that his last PSA blood test was in 2014. He was 72 years old at that time. So explain the PSA test, what it is, and when it makes sense to start testing and then start screening for it.
So starting screening is probably the most important part of this conversation, which is 40 in men who have risk factors, which are going to be a family history, first-degree relatives, brother, father, and then men who have histories of cancer in their family, colon, ovarian, breast, and pancreatic cancers, and then black men need to start at 40. Everybody else needs to start at 45. The question when to stop is a much more challenging question. So Prostate cancer is a disease where from the day of diagnosis to the day it actually causes harm, there's a pretty big lead time between those two numbers, on average 5 to 10 years. And so most guidelines would say you need to stop screening when we expect that you're not going to live longer than 5 to 10 years from that day of testing. Unfortunately, some guidelines draw an arbitrary number line, 69, 70, 75. There are a couple of different arbitrary lines that are drawn, but that fails to reflect the fact that we have men who live longer, who have healthier lives because of modern medicine, thankfully, the former president being one of those men.
Dr. Stites being one of those men, he's going to live forever.
That's my plan. I would, as Dr. Parker said to me, you'll die with, not of,
right.
prostate
So you'll
cancer,
continue to just get screened?
Yeah, I think I keep getting screened. I keep getting the prostate biopsies. You get 12 little biopsies in your prostate gland about every year and a half now. It's kind of the category I think I'm in. So, and I still get a PSA drawn every 6 months to make sure it hasn't changed.
So President Biden's been a strong advocate, as you know, for cancer research. How much progress has been made in this area? What's on the horizon?
Well, I think Dr. Parker will know much more about this than I do, but in general, we've made so much progress on cancer. It's a whole different age. I like to say that it's a golden age of medicine because of the things we have that we didn't have just a few years ago. In the old days where we just had their prostate taken out with lots of different kinds of complications, and today really not as many complications, and most people don't have to have it taken out. There's other things we can do, but I think, well, Parker knows
Coming to you
it.
next.
Yeah, I think that's the important thing is we've made huge strides in how we manage prostate cancer. I mean, cancers in general, but prostate cancer specifically. We've gone from an era where the only real management we had for advanced disease was suppressing men's testosterone, which would be essentially castration, to now we have multiple agents that are available that give men a longer life with a better quality of life.
So how can aggressive cancer be managed?
Well, that comes down to, are we dealing with a localized aggressive cancer, in which case we're going to talk about things like surgery or radiation, or are we talking about an aggressive cancer that has spread? Once prostate cancer has spread, we really need to leverage our understanding of hormone therapy, so medications to reduce that testosterone, plus other medications that really leverage how prostate cancer grows and divides to control the disease, which now we can effectively do for quite a long time.
All right, we've been getting some questions about prostate cancer. Marie wants to know, what are the symptoms of prostate cancer before it reaches stage 4?
For the vast majority of men, absolutely no symptoms. So this is one of the more challenging cancers in that men come to us not saying, I have a problem. They have a number, and then we unfortunately have to tell them they have a problem. When prostate cancer begins to develop symptoms, which are going to be things like obstructive urinary symptoms, so slowed urinary stream, trouble emptying, blood in the urine, pain, by that point the cancer has become far advanced.
Stu wants to know, generally speaking, how long would you estimate it typically takes for prostate cancer to go from 0 to stage 4 and metastasize to the bones?
That's a really good question. It's a really hard one to answer because we don't just monitor men until they develop that advanced disease. We use these off ramps whenever we see that the cancer is becoming more aggressive to intervene and treat. Most of us believe that the lead time is going to be somewhere between 3 to 5 years from when it starts, if left untreated, to it becoming more advanced. But that's a really crude estimate. All
right, last questions from Cindy. Are all prostate cancer types the same, and what does it mean when it is aggressive?
So types, generally speaking, they're all the same. They all are what are called an adenocarcinoma, which is a cancer of a gland. When it's becoming aggressive, it means that grading is becoming a higher grade, which means it has a higher potential to spread.
Dr. Stites, I'll start with you. What's the big takeaway today?
Know your family history, know your risk factors, and get screening done in the hands of people who know what to do with that information. I think that's always the most important. We have a family history of disease, and so I talk to my son now. Okay, dude, you got to get started screening at this age, and this is your risk factor. Let's make sure you get going. And I think that's the thing you have to do.
Great message. Dr. Parker, what's the big takeaway?
Yeah, I think for me, the thing that this really brings into stark relief is you have a former president who is receiving the best health care in theory that he can receive, and he gets diagnosed with advanced prostate cancer. This can happen to anybody. And so this is why it's incredibly important to be screened, to be an advocate for your health, to recognize healthcare is something that affects all of us, regardless of if you're well-resourced or not.
I know you both are really busy, but I know you're not too busy to talk about this. So thank you both for being here.
All right. Hey, thank you very much.
All right, guys, get off to your patients.
See you. Have a great
you.
weekend.
All right, you too. Well, when summer break starts, some students are tempted, as you can imagine, to just sit around, but dedicated athletes jump at the chance to drill down, lock in, and improve their game regardless of the sport. Alexis Del Cid is live at the Health Systems Sports and Medicine Performance Center in Overland Park, where young athletes are getting expert guidance. Alexis, good morning.
Jess, are you jealous that I'm outside?
I am.
You should be. What an amazing morning to kick off when we're talking about summer sports and summertime. Yes, I'm here outside on the outside field at the Sports Medicine and Performance Center, and I am here with Roger Allen and two incredible athletes. We're going to get to these two in just a few minutes, but first, Roger. Roger is a certified strength and conditioning specialist. He's also the strength and athletic development supervisor here at the health system. Roger, your team is so busy gearing up for the summer for your youth athlete training. It's a 10-week program and the age range is pretty big. It's 8 years old all the way through college. What is the main goal of this program?
Our number one goal is injury prevention, and then we're going to teach athletes how to move properly and most efficiently. We have a motto here at the health system, and specifically with my team, and that's the best ability is availability. All right, so it doesn't matter how fast or strong we make you. If you're hurt, you can't help your team. So first, we want to make sure athletes are healthy, and then we're going to improve them so that they can maximize their performance.
It's a pretty big age range of the kids you work with. I mean, age 8 to 21 as they enter senior year. I imagine you go a little easier on the 8-year-olds.
Only a little bit. No. So we separate them into different classes. So we have the developmental class, which is 8 to 12 years old, and then right at 13, that's when they join the sports performance and female sports performance classes, where that's 13 to 18-year-olds, and then we have a separate collegiate class for our higher level athletes.
So let's meet some of our high school athletes, and we have snagged two of them this morning. We have Max Mansky and Layla Boylan. Layla, I want to start with you. What year are you going to be next school year, and what sport do you play?
I'm going to be a junior and I play basketball.
And Max, what about you?
I'm going to be a senior and I play football.
And they both go to St. Thomas Aquinas High School. You're also both reigning state champions, which is incredible. Yay, that's a pretty big deal. Do you walk around, just strut through Kansas City, your state champions? Max, what are your summer goals?
Get my first D1 offer.
That's a pretty awesome goal. Okay. And Layla, what do you hope to accomplish by the start of next year?
I'm looking to improve on my explosiveness and quickness so that it will translate to my offensive game in basketball.
And when it comes to the sports they play, Max, you play on the offensive line. Also, Roger was an NFL lineman, so I bet you get some pretty amazing pointers from him. What's the biggest thing you've learned from Roger?
Just overall technique. I do one-on-one sessions with Roger, and he really has made me into the player I am today. I probably wouldn't even be playing football anymore without him.
And Layla, you're led through the drills by Mariah. We're going to show Mariah in a little bit because she's leading them through the drills this morning. What's the big thing you focus on with Mariah when it comes to basketball?
We focus on quickness, explosiveness, and we do vertical jumps, lateral jumps, stuff like that.
Show me that lateral move you were showing me. Okay. This just makes my quads hurt watching her.
Skater up and then stick it.
But
go back and forth.
You do hundreds of those with Mariah.
Yeah,
all right, it's drill time. Are you ready? Drill time for you, not me. All right, let's hit the field. Mariah, you ready over there?
I'm ready.
All right, Mariah is ready. Roger, what are you starting with?
So up first, we're going to start with our muscle activation phase. So with the muscle activation phase, we usually have about 4 exercises that we're going to move the athletes through. Today, we're just going to do the last one, which is the world's greatest stretch. This is called the world's greatest stretch because it activates a lot of the muscles in the entire body.
The world's greatest stretch.
Yes, ma'am.
It feels like it would be.
So in our muscle activation phase, we're going to ask the athletes to first flex a muscle and then turn around and stretch the muscle. Now, when we're stretching the muscle, it's not to get the muscle to relax, but actually to get blood flow to that area without fatiguing the athletes.
What muscles are they activating right now?
Everything. So that first movement is going to be the inner thigh adductors, then we're going to hit the thoracic spine, and then finally finishing with the calves and hamstrings.
And then what comes after the muscle activation?
Right after that, we're going to move into our movement prep. In some facilities, they call it dynamic warm-up. We've gone away from dynamic warm-up because sometimes the athletes will think it's not that important. And then they kind of only not work on it as well, don't really focus on it. So movement prep is part of the actual workout, and this is going to actually reinforce proper movement mechanics. And actually, these are the drills that high-level, Olympic-level athletes do every single day, a part of their normal workout. So we teach our athletes to try to perfect these movements, because then it's actually going to carry over to their sprinting technique.
How often are the kids here? How often are Layla and Max here?
Layla and Max are here about 2 to 3 times a week.
Okay. And we're showing an abbreviated version
Yes.
of their workouts. How long would they do those high step in those? How long do they do those for typically?
Yeah, so usually we're going to go 20 yards, which is what they're doing here, but we will usually have about anywhere from 5 to 10 movement prep exercises, depending on the session. Like, so today, Coach Mariah is focusing on linear speed, so that's straight ahead movements. So she's taking them through all the things and activating all the muscles that are going to be required for them to move quickly and move explosively.
They look like they're going so fast.
Yeah.
They look really fast to me. I would be panting. Wow. Look at Mariah's height.
Oh yeah,
Holy smokes! Now she was a basketball player too, right?
No, she was a collegiate mid-distance track athlete, and she also played rugby.
And she said she played basketball, but I guess she's like, I wasn't very serious. She looks like she'd be serious.
Yeah, in high school she played basketball. Yeah. Collegiately she played track and rugby.
This is great.
Which always impressed me, because I was like, she seems so girly, but at the same time she is very tough.
So cool, so cool. Hey Max, Mariah, how you guys doing? Good. Want to come on over here? Are they allowed to take a break, Mariah? Yes, they can. Okay, all right. As they head on over here, I have a question for you. How do you track the progress? Do you do a baseline assessment?
Absolutely. So the very first week of every program, we are going to do a testing where we're going to find out what their vertical jump is, their 10, 20, and 40-yard dash speed is, their 5, 10, 5, and the L drill. And that's going to give us an overall idea of where they come in at. And then at the end of the program, we're going to test them again because one of my former bosses used to say a great quote that I carried over here. It is, you can't change what you don't measure.
Right.
So we're going to measure where you're at, and we're going to measure where you finish, and that lets us know how well we're doing and then how well they're doing.
That's awesome. Roger, thanks.
Thank
okay,
you.
how are you guys feeling?
Good.
Yeah, out of breath at all?
A little bit.
A little
Not
bit?
too
A
bad.
little bit, yeah.
Well, we were talking about goals that you have, long-term goals, short-term goals. Some of them, do you have some scholarship offers already coming in?
Yeah.
How many?
I have 8 right now.
8? Are you kidding? And are you allowed to say, or are you humble?
I can say them, but okay. So I have KU, Nebraska, Colorado, Creighton, Wichita State, George Washington, and Sacramento State.
Are you leaning in any direction?
No, not right now. I'm just keeping it open still.
Well, because you're only going to be a junior,
Yeah.
Layla.
Yeah, so I'm just keeping my options open.
Does anyone else in your family play basketball?
Yeah. My whole family played basketball, and then I have 2 older siblings. They played basketball, and I have a younger brother who plays.
And Max, what are your goals for after graduation? You're hoping to get a D1 offer.
Yeah.
When do those typically happen?
Anywhere from start of junior year to end of senior year. It's about where you get most of your offers. And I already have a couple like NAIA schools, but I'm looking to get to that up level, you know?
For people who don't know, what does NAI mean?
It's the division below Division III, so they're mainly small schools under like 5,000 people there. And it's the lowest level of college athletics before community college.
When did you realize you loved football?
Probably would have been in middle school when I started playing O-line. I just like hitting people, you know?
Hitting people on the field.
Yeah, on the field.
I wouldn't want to be hit. I wouldn't want to take a hit from you. I'm sure no one does, right?
People don't usually like it, but
Except you.
they make do, yeah.
They make do. Do you have a dream college that you want to go to?
I'd love to play at K-State or one of the Ivy League schools.
Nice. Those are some awesome goals. Wow. And when did you start doing this program here at the Sports Performance Medicine Center?
I started with Roger 3 to 4 years ago when KU bought the whole facility, but I've been here since 5th grade.
We saw a move that Layla showed us. What were those called again? Those skater things? Yeah. Can you show us one of your moves? What's your favorite move when you're out here?
Should I do a kick slide?
A kick slide.
Yeah.
Okay.
So this is what you do when the offense is passing so that you can block the D lineman.
Okay. Okay. Okay, and how often do you do those? Can I try one?
Yeah.
Okay, well now I need you to talk me through it, so will you hold the microphone for me?
Yeah.
Now luckily I wore my Air Force Ones with my dress, so you know, I'm ready. All right, hold my scripts for me too.
Gonna want to get
hold up the microphone here so the audience can hear you.
You're gonna want to get in a stance like this,
okay,
and then get down in kind of a squat position.
Okay.
And then
wait,
put.
I feel like I'm doing the chair pose in yoga. What do I do with my hands?
You're gonna put one of your hands down like this.
Okay. How am I doing?
And then get most of your weight on one of your legs.
Okay. Wow. Which leg? Which leg?
I'd probably go with this one, and you're gonna push that way. So
okay,
like.
How do I push when my leg's in the air? What am I pushing with? Like if I do this.
Your back leg's gonna be in the air, and you're pushing with the other leg. If that makes sense.
It makes no sense. Will you show me? Show me. All right. Oh, so you're going that way.
Yeah.
Clearly, I'm not cut out for a D1 school of football. You know, I always thought it was my calling, but I think I'm much safer on the field if I have a microphone.
I mean, you'll get there one day, you know?
Oh, you think so?
Mm-hmm. If you put in the work and the effort, I think you could.
All right, I'm going to have to hit up Mariah for some tips after this, or Roger. See if you can show me how to bench press. Jessica, this is amazing. Come on over here, Layla. Layla, congratulations on all your scholarship offers that you already have.
I appreciate it.
So cool. And Max, congratulations to you on all your success so far.
Thank you.
I can't wait to see what both of you do. In fact, all summer long, we are going to be tracking Max and Layla to see their progress. We'll follow up with them in the fall, and we'll bring you updates on how their sports careers go as they finish out their school career. Max first, Layla second. It'll be so fun to see where Layla and Max wind up. Back to you, Jess.
All right, Alexis. I have a couple community questions for Roger this morning.
Okay.
Roger,
come on over here. We got some community questions.
Roger, Amy wants to know how you motivate these athletes in the morning.
Motivating the athletes really requires actually being energetic and fun. Usually with the younger athletes, we have to wake them up. All right, most of them have just gotten out of bed. They've only been up for like 15 minutes, and so I like to crack some jokes along with just be energetic ourselves. So I make sure I have my caffeine in my body, and the more energetic I am, the more they're going to start to reflect my behavior.
All right. The Roger Comedy Hour. I've got to hear that. That would be good. Okay, Jeremy has a question for you. Are there unique challenges for youth athletes and injuries since they are still growing and developing?
One more time?
Are there unique challenges because athletes are still growing and developing when it comes to injuries? Are there unique injuries?
Absolutely. So a lot of athletes, especially when they start to hit puberty and they're starting to hit the growth spurts, they start to experience growing pains, which makes it hard for them to go through all the movements we do. So if they're starting to experience pain, we try to modify and adjust the movements so that we can limit that as much as possible. But as life, you know, you're going to go through those growing pains. But our goal is to really focus on muscle activation and stabilizing the body, and then improving the athlete's mind-body awareness. Most athletes have no idea, you know, how to activate their quads, how to activate their glutes, how to activate their core. So we're going to teach them where their core is, how to squeeze those muscles, and teach them the purpose of how that's going to improve their balance and their ability to control their bodies, because lack of control will lead to injury.
And last question is from Stu. Roger, are there things that athletes will tell you that maybe they don't want to tell their parents or coaches?
Oh, 100%. We are their safe place because we are separate from their school, you know, so they can talk to us about exactly how they're feeling, about how they feel in their sport, how they feel about their coaches, how they feel about their parents. And we try to give them good advice, reinforce the great things that their parents are teaching them, along with giving them advice on how to win the favor of their coaches, because we were first athletes ourselves. We then became coaches, and so we know what coaches want to hear. We know what kind of behavior coaches want to see out of their athletes. So we can kind of give them some tips on how to improve their odds of getting on the field or staying on the field or getting to the next level.
Jess, I have a question for Roger. If I can ask him something, Roger, what are the sizes of your classes or your training programs? Like you mentioned, you have little ones and then all the way up to college. How many kids are with you at a time?
So we cap each class, each session at 18 athletes. Now, usually it won't get that big. At 9 athletes, we add a second coach. So we always try to keep our athlete to coach ratio 9-to-1 for the specific reason of we want every athlete, even in a group, to feel like this is a one-on-one personal training session. So I train all my coaches to spend time giving every single athlete one individualized attention and correction and feedback, so that each training session they can walk away with something they learned, something they enjoyed, and some knowledge that's going to help them improve their game.
Max and Layla are really intense athletes. They take their sports careers as you can tell they want to do this as a career and into college career. What about the 8-year-olds? How serious are they and how do they know what they want to do?
It truly depends on the athlete. Sometimes I get 8-year-olds that are going on 40, so they're extremely mature and really driven. And then sometimes I have kids that are here because their parents make them. And that's okay too, you know, so we try to make that fun. So no matter what the session is, we're going to try to make it fun, but then at the same time be goal oriented. And at the end of the day, our goal is for the athletes to walk out better than they came in.
And we know that Max, well, Layla, how long have you been seeing Roger?
I've seen Mariah for probably a year and a half now, I'd say.
And Max, you've been here since you were little.
Before this was the Sports Performance Center, I was coming here when I was like in 4th grade doing speed and agility stuff, up to like middle school starting weight training here. And now I do one-on-one sessions with Roger for football.
That is dedication. Jess, are you going to come out here and meet me? We'll hit the field.
Yeah, I'll leave that one to you. Looks fun though. They're working hard out there.
Probably safer that way.
Well, on that note though, Sean has a question.
I'm working hard watching.
Roger, Sean has a question though. How is the female athlete training different?
Great question. So our female sports performance class differs from our co-ed sports performance class only in the sense that there is a specific segment in the strength portion where we're going to focus on pelvic floor control. So science has shown that lack of pelvic floor control will lead to hip hinge and anterior pelvic tilt, which means the pelvis is tilting forward, which improves the likelihood of knee valgus, aka knees dropping in. And when those knees drop in, when you're trying to do a sharp change of direction, that can lead to an ACL tear. All right, so Dr. Lisa Vopot is our director of medicine for our Sports Performance Center, and she has a whole female sports performance program where we focus on care from an injured athlete all the way to a healthy athlete, trying to prevent those injuries from happening. And so in our class, we really focus on improving the strength of the pelvic floor, control of the pelvic floor, mind-body awareness of the pelvic floor, and then how to stabilize their hip complex so that when they go into those change of directions or those movements that put their body in jeopardy, you know, they can bend but don't break.
Roger, Alexis, Layla, Max, thank you so much this morning. A quick programming note for you. Starting next week, we will bring you encore presentations of our very favorite episodes. Over the summer, however, our team will be working to bring you new stories like these for the fall. Siblings, as you can imagine, share a lot. And in this case, these 3 siblings share the same diagnosis. For years, they were misdiagnosed, teased in school for having Tourette's syndrome. How they're finally finding answers and treatment for their rare movement disorder. And you recognize the name in the dairy aisle, how the Belfontes took their tight-knit family to a whole new level when one family member helped save the life of another. Plus, you see her artwork when you fly in and out of the Kansas City airport, how this local artist is finding strength and inspiring others after a surprising cancer diagnosis. We will resume regular live streaming after Labor Day on Tuesday, September 2nd. And if there's a public health story you need to know about, we will bring it to you right here. And as always, you can keep in touch by emailing the Medical News Network. Thank you again for watching, and we will see you next time.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now, everywhere podcasts are available.